adverse events. So what's happening is now we're doing the stem cell deployment within an experimental design. Albeit it's an experimental design where you're actually paying for the work that's being done, but it's a design where we're going to track things to make sure that there are no adverse events. We're going to track things to see evaluation of the conditions treated, to see what effect stem cells are actually having on stromal vascular fraction. What's really exciting about this is we're trying to do this within a multidisciplinary framework. As Megan mentioned earlier, a lot of times doctors don't work together. But the whole point of what we're setting up here is that we're going to have a team of doctors that are working with this. So, fine, if you come in and you have a kidney condition, well, we're going to review this in the context with a nephrologist. If you have a hematologic condition that we're thinking about, we're going to review this in that context, and so on and so forth. So that because each field, there's an application for this therapy. Each field of medicine is an application from this therapy, and I'm going to highlight some of the literature that suggests that. Right, so within this treatment, we can make no claims. We make no claims, we can't promise anything. We can cite examples of what's been done. As I mentioned, the piece that's nice is that if you come in and you have a condition that I haven't treated, okay, I can call up any number of doctors around the country to find out their experience, because at this point it's all anecdotal. It's all anecdotal. So protocols are constantly being developed, in terms of what seems like to be the best practice scenario. Realistically, this is the only way medicine can move forward. Because if not, what are we waiting for? We're waiting for a drug company to actually take over and develop it and do something with it, and it turns into something else. So doctors working together can actually figure out from a therapy that's safe, is involving giving you back cells from your own body, right? What we can't do right now, which is unfortunate, is that we can't culture the cells, meaning that we can't take a few cells and then expand them, right, and then give them back to you. And some of the research where they actually have done that, that's been some of the most interesting research. Because we're talking about regrowing organs outside of the body. And we'll get to some of that. Again, from the literature, right, these are some of the conditions that have shown to yield to various stem cell therapies. This is stuff that's in the literature. Okay? Keep going. So I'm going to highlight some of interesting breakthrough studies. This is Dr. Taylor, who's a heart specialist, who's actually now at the Texas Heart Institute. In 2008, they were able to actually take rats and regrow their hearts outside of their body by just using like an organic matrix and using stem cells from the rat